something that we all must have experienced. Pain is also a subject that has been studied and questioned from very early on. Conditions associated with pain is a big problem globally and a massive financial burden. It has been suggested that about 20% of adults worldwide suffer from pain and 10% of adults have chronic pain. According to World Health Organization, they reported that low back pain is among the top 10 diseases and injuries that lead to disability, time off work and activity limitations. It leads to increased economic burden on families, the individuals themselves, companies and governments. Hello, Namaste viewers. Welcome back to our channel PhysioHealer. In today's session, we are going to discuss about phases of pain, how to assess pain, different pain measures, some self-reported pain measures and outcomes of pain assessment. What happens when we experience pain? Let's go through the process happening in your body when you experience pain. Say that you were to touch a burning hot stove top. You would immediately feel it burning your hand and pull your hand away very quickly. Most probably you would feel pain in your fingers where you have been burnt. This all happens in a milliseconds and is something you don't even have to think about doing. This whole reaction can be broken down into steps. Firstly, some nerve endings in your muscles, skin and joints will be stimulated by you touching the stove top. Secondly, nerve endings to your spinal cord and then to your brain to say that something dangerous could be happening. Thirdly, this message will be processed by your brain. Your brain will decide how dangerous the stimulus is, and by evaluating the situation, what you are seeing and what previous experiences you have had like this, only then will a message be sent back down to your hand, and only then will you experience pain and pull your hand away from the stove top. Everyone has a nervous system that works through the same process. However, the efficacy and sensitivity of every person's nervous system is different. Why do you experience pain? Many theories and explanations have been given to describe pain and to answer people's questions. Why I am in pain or what is causing my pain? It has however been proven that your brain is responsible for any pain that you are feeling. But that doesn't mean that the pain is only in your head. Let's get to the reason why we experience pain. Pain is there to protect us. Pain is something that motivates us to take action, to avoid injury and to give our tissues a chance to heal. Pain is something that every person will experience quite differently. Pain can only be measured by what you say it is. Only you are able to describe it. We could try to measure pain intensity by asking you if you can score your pain on a scale of 1 to 10. You could describe your pain as dull, burning or sharp pain. People also respond very differently to pain. One person might be distracted by pain and will take much longer than usual to do a certain task. Someone else might use task as a distraction from pain. There is no right or wrong regarding what you should feel. However, it is becoming more and more evident that we should look at pain differently. The International Association for the Study of Pain gives us the following definition for pain: an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or it is described in terms of such damage. Let's discuss pain phases. When assessing pain, it is important to recognize the difference between acute and persistent or chronic pain and the implications for assessment and management of the patient. Acute pain phase performance of a comprehensive assessment using reliable and validated tools to prevent the onset of chronicity is of utmost importance. Persistent or chronic pain: when the persistent pain presents, it is important to gather an understanding of factors contributing to the persistence of pain. Starting with pain assessment. Often when assessing pain, we use a biopsychosocial approach for the assessment of pain and disability, as it accounts for the multidimensional nature of pain in domains relevant to physical therapy practice. A biopsychosocial assessment should seek to identify the following criteria. Bio means triage and identification of the pathology or red flags. Psycho means psychological distress, fear or avoidance beliefs of patient. current coping methods and attribution of the patient, that is described as yellow flags or orange flags. Social means work issues, family circumstances and benefits, economics, they are considered as blue and black flags. During our assessment, we must account for the multidimensional nature of pain by including appropriate assessment measures for primary domains, which includes sensory, affective, cognitive, physiological and behavioral. The effects of pain can be complex and can traverse many intersecting domains. If we discuss about pain measures, despite the difficulty inherent to measuring pain, there are a number of accepted tools for tracking pain-related treatment outcomes. The proper use of these tools can allow physiotherapists and researchers to demonstrate both statistically and clinically significant treatment effects. Commonly used measures for different pain dimensions include: first one is self-reported measures. They include physical performance measures including functional capacity evaluations, that is described as FCEs. Physiological or autonomic response measures are chronic pain has multiple effects on patients. So outcome measures cover several domains like pain quantity, pain interference, physical functioning, emotional functioning and quality of life. Then we have patient-reported global rating system. These measures each have their own strengths and limitations for different pain dimensions which we must recognize. Let's discuss some self-reported measures of pain scales. It includes numerical pain rating scale NPRS, visual analog scale VAS, verbal rating scale VRS. Patient global impressions of change pain interference include Roland and Morris Disability Index, Austri Low Back Pain Disability Questionnaire. Some physical functions of pain include brief pain inventory, quality of life, Orxol 5D. Emotional distress functioning include back depression inventory BDI-1, Center for Epidemiological Studies Depression Scale, Hospital Anxiety and Depression Scale HADS, some profile of mood states, the Pain Efficacy Questionnaire PSEQ, short form McGill Pain Questionnaire SF-MPQ, short form McGill Pain Questionnaire 2 SF-MPQ2, brief pain inventory, that is a short form, Westhaven Yale Multidimensional Pain Inventory, treatment outcomes of pain survey, short form 36 bodily pain scale pain detect, neuropathic pain questionnaire NPQ, 4-item pain intensity measure P4, ID pain, and some functional pain scale include pain categorizing scale and Starbeck screening tool. An individual's ability to persist through a questionnaire depends on a number of individual and environmental factors. Example, attention span, interest in the scale, dedication to the project, incentives, outside distractors or item complexity. Conservatively, questionnaire packets should be able to complete it by the majority of individuals in under 25 minutes. These longer packets may also be combined with more frequently administered single item measures to provide a balance of depth of information and temporal resolution. If we start discussing physical performance measure, many physical functioning and performance tests such as range of motion exist and have been used as a proxy for objective pain measurement. Examples of standardized performance or functioning tests for chronic pain include the following tests. For example, the loaded forward reach test for chronic back pain, time up and go test for osteoarthritis, grip strength for rheumatoid arthritis, the Abbey Pain Scale for the observation of physical presentation of non-verbal individuals, example those with dementia. Pain is just one component of physical performance, and other factors such as fear of pain may heavily impact the performance scores. Therefore, although clinical-based tests of functioning can complement self-reported pain measures in chronic conditions, and they are not useful as a pain report substitute. Physiological or autonomic response measures are as important. Younger states that the field of pain management would benefit enormously with an objective physiological marker of pain and describes how several physiologic variables such as skin conductance and heart rate have been measured for this purpose. In general, however, these markers do not correlate strongly enough with pain to warrant their use as surrogate measure of pain. Pain can exist in absence of changes in these measures also, and these measures can fluctuate drastically with no change in pain. These peripheral measures indicate general autonomic activity which can be influenced by many factors other than pain, such as other forms of arousal. Also, treatment may directly impact those physiologic variables, further reducing their reliability as a clean pain measures. Work still continues in this area with tests of more sophisticated measurement approaches or biomarkers of pain intensity. Individualized assessment, it is important to modify pain assessment strategies to match inherent variability associated with the patient's clinical presentation. Individual factors such as age, gender, etc., socio-cultural influence, for example, spirituality and ethnicity, clinical characteristics of pain, for example, duration and anatomical location, pain types and state, for example, neuropathic pain, cancer pain, etc., vulnerable populations, for example, communication barriers or cognitive impairment. What are the outcomes of pain assessment? Following assessment of pain, suitable management strategies can be implemented. However, as always, it is important to understand the need to monitor and review the effectiveness of treatment, management and modify treatment and management strategies appropriately for the progression of recovery. Refer to relevant health professional as appropriate and in a timely manner. An excellent resource to this topic is the British Pain Society. You can find a compilation of their pain outcome measures in the below link. It's time to discuss some tips for pain assessment. You can remember the short form PQRST. P stands for provocation or palliation. In this, you are going to ask to your patient, what were you doing when the pain started? What caused it? What makes it better or worse? What seems to trigger it? The stress, position or certain activities. What relieves it? Medications, massage, heat or cold, changing the position or being active or resting. What aggravates the pain? Movement, bending, lying down, walking or standing. Q stands for quality and quantity of pain. How will you ask to your patient? What does it feel like? Use words to describe the pain such as sharp, dull, stabbing, burning pain, crushing, throbbing, nauseating pain, shooting pain, twisting or stretching pain. R stands for region and radiation of pain. You are going to ask to your patient, where is the pain located? Does the pain radiate? Where? Does it feel like it travels or moves around? Did it start elsewhere and now it is localized to one spot? S stands for severity scale. How severe is the pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain ever? Does it interfere with activities? And how bad is it at it is worst? Does it force you to sit down, lie down, slow down? How long does an episode last? And last, T for timing. How to confirm this with your patient? You are going to ask to your patient, when or at what time did the pain start? How long did it start? And how long did it last? How often does it occur? Hourly, daily, weekly, monthly? Is it sudden or gradual? What were you doing when you first experienced that time of pain? When do you usually experience it? Daytime, nighttime, early morning? Are you ever awakened by the pain? Does it lead to anything else? Is it accompanied by other signs and symptoms? Does it ever occur before, during or after the meals, and does it occur seasonally? If you have any questions or suggestions for us, you can write down in the comment section below and we'll try to reply as early as we can. Thank you for watching today's video guys. See you soon next time. Stay tuned for that, and if you like today's video, don't forget to like, share and subscribe us.